Thank you. Fiona, I don't see Marilyn back on again, do you?
No, I don't see her.
I'll try to call her in, see if that helps.
Okay.
Shall we just deal with the preliminaries just now then?
Yeah, will I read out the...
Yeah, if you could do.
Good afternoon, everybody. Just a couple of comments I've got to read before the actual recording. Participants should mute their microphones unless they're invited to speak. Camera should be switched on where possible. We understand some people might have broadband issues, so if you're not able to do that, that's fine. All those waiting to speak should use the hands up function. If your hands up function is not working, please just physically put your hand up on the screen and I'll see that and let you in. And mobile phone should be switched to silent. Participants should refrain from using the chat messenger function to conduct conversations. A reminder that the meeting will be recorded and later made available on the website for public viewing. And in the event there's a break in the meeting, the recording will be paused. If any voting members have to leave the meeting early, they should notify the clerk or the chair before doing so. And a reminder that the roll call will no longer be used for approval of report recommendations. Instead, voting will be by consensus, with voting members asked to indicate their general agreement. Okay, and if I could just check, Marilyn, are you back in? And can you hear us okay, Marilyn? I don't think she can.
I don't see her on the list. I don't think
I
she's
see her on the screen. I can see that Marilyn is on the screen. I'm not sure if she can hear us.
Thanks very much.
You can hear, that's great. Thank you. Marilyn, I just wanted to check. I know we had that conversation around your other commitments, and I just wanted to check with you if you were happy for me to share that with all the members.
That's fine, Shamin. Thank you.
All right. Thank you. Thank you very much. Thank you, Marilyn. Thank you, everybody, for bearing with us. We're a little bit later than we scheduled to start, so thank you so much. And welcome, everybody, to our 18th of December 2025 meeting of East Lothian IJB. Fiona, can I check if there's any apologies?
Before they do it, I do the apologies, Chair. I'll just read out the GDPR announcement.
Thank you.
This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are data controllers under the Data Protection Act 2018, and data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available on the website for up to 5 years. We do have apologies today from Andrew Cogan, John Hardman, Claire McIntosh and Fiona Wilson. I'll go ahead and do the roll call of attendees now, so when you hear your name, if you could let me know you're here, please. Shamin Akhtar.
Present.
Liz Allen.
Present.
Jeremy Finlay. Jeremy? No. Carol McFarlane.
Present.
Thank you. Jonathan Blaseby.
Hello, I'm present.
Thank you. Patricia Cantley.
Present.
Elizabeth Gordon.
Present.
Maureen Allen. David Binney.
I'm here, thank you.
Thank you. Darren Bradley. Lindsay Byrne.
Present.
Sarah Gosner.
Present.
David Hood.
Present.
Kalondi Kasangeli.
Present.
Thank you. Claire MacDonald. Marilyn McNeil.
Present.
Liam Kerr. And Mike Porteous.
Present.
Thank you. Do any members have any declarations of interest? No, I don't see any hands up. That's great, thank you. That's us ready to move on to the business, Chair.
Thank you, Fiona. And we move to agenda item number 1, which is the minute of the last meeting. Could I just check that you've all had the opportunity to read that and just to prove that it's an accurate reflection of the meeting on the 30th of October? Can you just nod your head if you think that's an accurate reflection? Okay, thank you. And move on to agenda item 2 for any matters arising from the minutes of the last meeting. So anything on page 1? Page 2? I'll pick up the matter raised on page 2. Jonathan, you'd raised about the carers' breaks and the financial implications of that. So that was something that I raised. There is a COSLA Health and Social Care Board and asked around that. So what they've indicated that there will be a public consultation on draft regulations. They do have a group that's working with Scottish Government on this area, and on that group is a chief financial officer that sits on it to make sure that they're fully cognizant of the financial implications of that. So I've just asked for updates as that's happening, and I think they were supposed to be by the end of the year, but I haven't seen anything come out. So I think it'll be important for us to be able to make sure we contribute to the public consultation on the draft regulations when they come out as East Lothian IJB, and make sure that we work closely with carers of East Lothian and to make sure we have a good response back. So hopefully that'll help to cover the point that you'd raised, John. And any matters arising on page 3? Page 4? Page 5? And page 6. Okay, thank you. That's the minutes. Move on to we now have a rolling action log, and everybody would have received a copy of that. So I just want to check if there's any comments or feedback on that. Mike?
Just to say that we did have a chat about the set aside in the development day. So unless anybody's got any further queries around that, can that one be marked as complete?
Okay. Yeah, I do recall we mentioned it, but I think will there be still work ongoing as we work our way through the budget process of?
Oh, absolutely, yeah. I mean,
okay.
It's a subject matter that will come up in almost every discussion I think we have around the budget setting, and so yeah, it'll be part of our discussions. So whether you need to leave it on the action log then, or whether we can note it as being that, we will deal with it every time it comes up in the discussions. Okay,
if we could just get a reassurance, I think it's an important area for us to keep engaging with our partners on that one. Okay, John?
Sorry, just on the end of the minutes, previous one, just out of interest, who was appointed as the audit and risk chair at the recent meeting?
Elizabeth Gordon.
Okay, thank you.
Okay, and we'll keep that action log, and as things are completed, take them off. John? Did you want to come back on anything? No,
sorry, you're asking me? Sorry.
Yeah, because I think you had your hand up and then you put it back down, so I think.
No, just about nothing more from me.
Okay, thank you. Okay, that's the action log complete. And the next one is agenda item 3, which is chair's report. There were just a couple of things I wanted to mention. Firstly, I just want to mention and just to thank Marilyn for being the service users rep for a number of years on East Lothian IJB. She's communicated, we had a discussion, due to other commitments, she's no longer able to continue in her role. And I just want to thank her for being a committed member of East Lothian IJB, but also around East Lothian. I know she's taken a keen interest in our health and wellbeing groups and the area partnerships, and also want to take the opportunity to thank her for coming along to the Musselburgh Dementia Meeting Centre, and say thank you, Marilyn, for all the work that you've been doing, and this will be your last meeting, is that
Yes, that's
correct?
Thanks so much,
Okay.
Shamin. I've really enjoyed my role, and I think, as you're aware, there may be a voting capacity for the next person that comes as user representative, and I think that would be helpful to be able to contribute, at that level.
Okay, thank you. Thanks very much, Marilyn. Really appreciate all your effort and support over the year, over the number of years that you've been on here. Just a few things. I'm happy to provide a bit more detail with a written report. This year we had the East Lothian Carers of East Lothian annual general meeting. So it was really great to see. It was really, really busy. And Jane White, the chief executive, had a really good engaging session with all the carers there, and Claire Spedden, the deputy chief executive. But one thing I did want to mention is around, by the end of the year, Carers of East Lothian would have been in touch with 7,294 carers. And the feedback from those carers is that 84% felt they were able to better cope with their caring role. So I just want to highlight the level of support that Carers of East Lothian are providing to carers across the county, and the feedback those carers are giving to the service that's provided by Carers of East Lothian. And I think it just highlights the need to make sure that we're providing that support, and that carers are suffering from fatigue and stress, and we have to make sure that we're providing the best support possible in that caring role. I don't know, David, if you want to say anything else around the carers AGM.
The most meaningful session was when people were contributing to their vision of the future for the organisation and for services that need to be provided. It was very positive, interactive, and I expect that there will be many good things that will flow from that session.
Okay, thank you. There's a few other things that are direct linked to our strategic directions, which was the Volunteer Centre East Lothian had their annual conference. It was really busy with organisations right across the county attending, and they did have a participant from Scottish Government to discuss public sector reform. So that gave us the opportunity to highlight that East Lothian is one of the fastest growing areas in Scotland. So if there is any level of public sector reform, it's really important that there's cognizance of that. We're looking to develop more services, not less, for East Lothian. I visited Crookston Care Home with Pauline Sked, the manager there. It was really, really, really inspiring, great visit to see all the great work that the staff are doing. There's over 100 staff, over 150 staff that work at Crookston Care Home. I didn't get a chance to meet all the staff, but it was great to see the care that they were providing to the residents there, and meet some of the families and some of the staff. So I took the opportunity to write to all the staff, because I thought that they were doing a great job. And also, you would have seen over the last number of years, their inspection reports have been 5. So the level of care that they provide is really exceptional. Also attended East Lothian Carers LCAP AGM. And I'm happy to share their annual report with them. They're looking at how they're developing and providing more support locally, and they've done a huge amount of engagement with their service users, which is really good to see. Also want to mention the COSLA Health and Social Care Board. There were 2 issues that I raised at that board. One was around the carers breaks and the funding for that, and also the removal of non-residential care charges. That's been something that the government have said they're committed to doing. So I've continually been raising that on behalf of East Lothian, of when that might be coming through. Unfortunately, at that meeting, there was no indication of those non-residential care charges being removed as such. But we do know that that COSLA are continually engaging with the appropriate levels of government and civil service, just to highlight the challenges that IJBs face and on non-residential care charging. I'll also share with you, there was a Pioneer Digital Telecare Conference, an online training session for an hour. It was really, really enlightening of how telecare is being used to support health and social care, and how different levels of technology are being used to provide services for people in their homes. And Enjoy Leisure had a health and wellbeing progress update about the work their health and wellbeing team are doing with NHS Lothian around rehabilitation. So they had a really helpful presentation about the impact that they're having on individuals that are using the service and getting them active and moving. So I'll share that with everybody. That was really, really helpful. And finally, I attended the East Lothian Council Inspire Awards just to recognise the work that staff across the county are doing on a day-to-day basis in supporting people and supporting health and social care as well. Okay, I don't know if anybody has any questions. John?
Well, actually, yeah, thanks, Jermaine, for the update. Actually, it's on a different topic, if you don't mind. I think everyone on the call will be aware of the consultation the government put out recently in relation, in fact, Marilyn alluded to or mentioned it earlier, in terms of extending voting rights for IJBs to service users, unpaid carers and third sector organisations. And I know that I guess you and Andrew as chair and vice chair received that letter and were asked for comments. I know that NHS Lothian has provided, or I think NHS Lothian has provided its comments. I guess my question is, did the IJB or did you or Andrew provide comments, or the IJB generally provide comments back to the government, or can you provide any more colour on that, maybe, or even the council as well? I guess the East Lothian Council must have been asked for comments as well. I guess, I don't know.
Yeah, I provided my feedback to the Health and Social Care Board as a paper that came up there, and I said I reflected on our experience in East Lothian, which has been a really positive one. That's a really valuable service user rep, is a really valuable person on our IJB, and I supported voting rights for them. So that was the position that I took at the Health and Social Care Board, reflecting on our experience. Different IJBs had different experiences, but I reflected on ours as a positive thing. Does that help?
Yeah, I guess so. There was no need, I guess, as an IJB to be responding, was it? Because it seemed to be just directed. I guess we were free to make these comments. I guess given we were obviously by copy we were notified of the consult, which is actually finished anyway. They only gave us 2 weeks to respond anyway, which was which I never really understood in terms of why it was such a short period to respond. But I guess that's already closed anyway, that consultation period. But I don't know. I mean, I'm just interested to hear views of others as well in terms of kind of where this might be heading, or what the next steps are.
Well, one of the feedbacks given to them was 2 weeks. It was a really short turnaround time to be able to get meaningful feedback from IJBs. Some IJBs didn't have their meetings, etc. But that was feedback that was passed on to them. Laura, did you want to come in?
Yeah, it was just to say I had thought, but maybe we didn't have time, that the IJB that Andrew had shared and perhaps making an IJB response. As you say, John, I think that was the thought as well. There had been some to and fro with the standards officers, and some important points raised, which hopefully will have gone back around the logistics of people being able to vote, so that you would have to be employed by one of the partners, etc. The requirement for perhaps payment rather than being a voluntary thing, the understanding of that position, etc., etc. So I think on paper it feels to me like a really good idea. Of course, we want people to have votes and be democratic, and how do we show that people are being heard? But the logistics of it and the mechanics and the legislation is maybe preventing that. So I'm hopeful that maybe the IJB did respond. I haven't seen it. I haven't seen anything, but I think other IJBs in Lothian will have responded as per the standard officer's response. I think one of the things that we should consider, no matter the outcome of that, is how do we evidence that we are taking non-voting members' opinions when we finally take a vote? And I think we maybe lack our evidence trail of that, and it's something maybe the IJB might like to think about one of the development sessions. How do we show that we are still voting or not, taking other people's opinions in, and making sure that's clearly auditable?
Okay, thanks.
We'll take a note to cover that at a development session of when we have papers coming forward or decision making, how we're making sure that we do that as an IJB. And I'm sure we won't be the only ones doing that. Other IJBs will be doing that as well. So if people are on other IJBs and they want to share how they might be doing that in other IJBs, that'd be really helpful. Okay. Thank you, John. Was there, I think that was it. Don't think there was anything else, but I will definitely share the presentations from some of the meetings that I've been to that have been really, really helpful. Hopefully you'll find that useful as well. Okay, move on to agenda item number 4, which is the review of the IJB strategic plan.
Yeah, I'll come in on this. Claire's on leave just now. So it's really, in the SPG will have seen this, it's really just to get confirmation or agreement from the IJB that the strategic plan will be slightly delayed in order to allow it to go through the partners' relevant management committees for endorsement of our new strategic plan. So it's just noted, I think, in 3.4 that the plan is now that the strategic plan will come to the IJB in its meeting on the 26th of February. So unfortunate slight delay. I can barely look at Jonathan, but it does allow us then to take it to all of our management, our 2 partners' management committees for them to endorse it, which is a vital part of agreeing the strategic plan.
Okay, thank you. Do we have any questions on this or any comments on this? I think, are we fairly content in extending it? Patricia?
It was just to say, pleased to see that there's going to be an integrated impact assessment. And as Laura says, if that takes time to do that, I think that's another very good thing. So anything that we do, we need to keep going back to, as we learned about previously, the importance of the integrated impact assessment. So I'm pleased to see that getting not necessarily prominence, but is very much noted there. So look forward to the meeting in February. Thank you.
Okay, thank you. Do you have any other comments or questions? I don't see any other. No. Trish, did you want to come back in? Okay. Patricia, Elizabeth?
Thanks. Just a really quick question. It's maybe not necessary given the short time frame, but is there any kind of informal or formal extension of the existing strategic plan into this gap, just in case the delay was to be further extended?
Nothing formal. No, note your point. Note your point. I think if it is to be extended further, that would be something we would consider. Obviously, the delivery plan will still cover the full year of 26, which is probably the important part. But realise that slight gap now. But no, nothing.
Yeah. Thanks. Okay.
Okay, thank you. I think some IJBs have already produced their plans. Lothian has produced theirs. It went to the NHS Lothian board, and I think it came across as a really kind of well integrated the way it was presented. So I think it's worth having a look at how Lothian IJB have presented their strategic plan. Okay, I think this is just for noting, so we're fairly content to extend the timescale to enable everything to happen. Okay, thank you. Move on to agenda item number 5, which is a commissioning strategy and market facilitation statement. Is that with yourself, Andrew?
That's correct, Chair. Thank you very much. Thank you. So today I'm just presenting a refreshed commissioning strategy and market facilitation statement for 2025 to 2030, which aligns with our draft IJB strategic plan. It's coming today just for consideration and hopefully for approval. The new document simplifies our 2 previous documents. We previously had a commissioning strategy and a market facilitation statement. They were initially separate because they were developed at different times. So ultimately this gave us an opportunity to pull them together. There was a bit of repetition and duplication across both the previous documents, so that has now been sorted out and simplified, and the new document is much shorter and hopefully a slightly easier read for those that were expecting to pick up on the key points. We have ultimately aiming to publish alongside the updated strategic plan, and by bringing it today for approval, we're definitely on track for that. The commissioning intentions, key market messages and priorities have been updated. We've also been to the commissioning board on the 7th of October, followed by the SPG on the 20th of November, to just ask key partners and stakeholders for their input and their comments on the draft document. Taken a variety of feedback on board and made necessary changes to the document, including some feedback from the Chief Finance Officer on our key market messages, and we've incorporated some changes from Mike, so thank you for those. And we've also incorporated some further information in relation to East Lothian Council as an anchor institution and some core and cluster information into the current supply section of the document, and that was thanks to feedback from the chair. So thank you to everyone who provided feedback on it thus far. I think everything else of relevance is in the covering paper, but I'd be happy to take and answer any questions if anyone has any points for clarification prior to seeking approval.
Okay, thank you, Andrew. Do we have any questions or comments for Andrew? John?
Yeah, hi, thanks, Andrew. Yeah, I mean, I think it's, I haven't read through it. I mean, it seems very sensible, very well intended. I guess my question is really around, how do we measure the progress against this and sort of success of the strategy? I'm a bit unclear looking at it at this to sort of see how we do that. So I guess it was just a bit of clarity around how over the next 5 years we will sort of measure against this and look at the progress. I mean, there was talk in there about a performance framework. I don't know if I kind of misread that. That talks about preparing or coming up with developing a performance framework and talking about quarterly reporting against national outcomes. So I'm not sure if that's kind of how we do it, but that would be my question, really, not really the content, which seems to make sense. It's kind of how do we hold ourselves to account in relation to this? Thank you.
I think that would mostly align with our progress against our strategic plan and the priorities that are outlined in the strategic plan, which would then be linked into our annual performance reporting in terms of our IJB performance. Ultimately, my understanding was that the IJB had intentions to produce a performance framework. I believe that to still be the case, which is why it still remains in the plan, but I can't comment on progress on that particular item. I don't know, Laura, in Claire's absence, or possibly Paul, has any further information on that performance framework.
So there is a performance framework for which the HSCP, I guess, will be delivering on, and then we'll be able to show the outcomes. I think John's question is how will we know around, the achievements within that strategy and that market facilitation? How will we know that we've stabilised the market, grown the market where we need it to do, commissioned in the correct way? And I think a lot of that is measured in other plans. I don't know what your thoughts are, Andrew, but it's measured by, okay, how are we doing with regards to care at home? How are we doing on our overall grant awards, etc. So I don't know if we have a kind of framework that responds to that, or whether it's dealt with, I suppose, within our own different services will be commissioned.
I think you're right, Laura, in so much as there are various work streams that are addressing with certain sections of the market, not in isolation, but on specific subject matters, whether that be community support frameworks, care at home, self-directed support, independent advocacy. The list goes on and on. But I would agree there isn't a naturally aligned framework with this particular strategy, which allows us to monitor the performance against the key market messages and intentions that are within this one. It's more spread amongst the wider strategic approach and commissioning approach.
Okay, so just picking up on Jonathan's report, it's really important, Jonathan, to be able to, as an IJB, know that we've delivered on outcomes. So maybe you could come back to say how that'll be maybe tightened up, that if there is a performance framework, what that looks like. But if the other monitoring and evaluation process that you have for other projects, how they'll feed into that, just to make sure that the outcomes have been met, and we can demonstrate to the public that we are meeting outcomes, and this is how we're spending money, and that is delivering the appropriate outcomes, and at the end of the day it's the best outcome for that person to be able to live in their local community. Is that something, Laura and Andrew, you could come back on, just so we're reassured that there's a robust performance framework, even though what you're describing is there, but in different kind of different ways?
Yes,
okay?
I'm absolutely happy to have further discussions with Laura and with Claire and Christine Johnson as well to explore that and bring back a further update to a future IJB.
Okay, that's great, thank you. One thing that did come up at the strategic planning group was around the commissioning. That does this document help us? We have a number of community-based organisations of being able to who have if they have demonstrated good outcomes, have good connections with local community, etc. Of how do we make sure that maybe they might be given more preference over maybe a national one that may not have connections or be as robust, where that might be appropriate. Does this allow us to do that?
I think in line with the feedback and discussions that took place following the SPG meeting, that would be more aligned with the particular procurement strategies or approaches to individual commissioning activity. So when you're outlining your method statements to commission a service, you would want to make sure that your community benefits and wealth building and such, there's a focus on that within the scoring and the evaluation of any tenders, so that we are encouraging that local focus and promoting the local market from a provider's perspective.
Okay, I think that's important because IJB, that health is an anchor institution in itself to support the local economy and to support local organisations and do that community wealth building around the county. Okay, thank you. I just want to check if there's any other comments or questions for Andrew. I don't see any other comments or questions for you, Andrew, so we content to agree the commissioning strategy and market facilitation statement with the additional information around the performance framework. Yeah, okay, thank you. Move on to agenda item number 6, which is the Chief Social Work Officer's report. That's the annual report for 23-24. And before we start, I just want to apologise. This was presented to Council in February this year, and what in normal circumstances it would follow the IJB, but it hasn't in this case. But what we'll do is make sure that when it is going to the other partner organisations, it follows on to the IJB not too long afterwards, and there's not a big gap in between. And so if you're wondering why this is so late in the day, that's the reasons for it. So we'll take a note to make sure that doesn't happen again. And Lindsay, you're going to present that?
Yeah, thank you.
Thank you.
For those who don't know me, I'm Lindsay Byrne. I'm Chief Social Work Officer for East Lothian. And yeah, you're right. This should come with a health warning. This is 23-24, and I will very shortly be bringing back the 24-25 report, which is currently being finalised. It will go to Council in February, and then the next IJB, the next report will be on the agenda for here. So apologies for that oversight on the part of numerous people. I was asked to bring this at very last minute, so apologies. It's not completely fresh in my mind, the data from last time, but I'll do my best to answer any questions that you might have. So if you don't know, Section 45 of the Local Government Scotland Act sets out that every local authority should have a Chief Social Work Officer. And there's a statutory requirement for that social work officer to produce an annual report about the activities and performance of social work services across the council and the Health and Social Care Partnership. So each report reflects the strategic and operational delivery of services across children's social work services, justice social work, mental health, and all the different parts that make up adult social work and social care services. It provides an overview of all professional social work activity through the delivery of statutory functions, which are the responsibilities of a Chief Social Work Officer. So it's always a really nice opportunity to highlight the efforts of social work and social care workforce and who really do work tirelessly to protect people from harm and to support them to live safely and as independently as possible in their own homes and communities. So, as you'll be aware, social work services includes a wide range of statutory duties, and continuing to meet those in times of extreme financial pressure continues to remain a challenge. And as Chief Social Work Officer, it's always my job to assure members about social work practice in East Lothian, but also to be open about the challenge the profession faces as a result of growth, demand, and national policy expectations. So when I wrote this report, I was very confident that we're prioritising the right evidence-based practice and strategic development, and without giving away too many spoilers, I do remain confident about that in the next report coming. And I'm always really proud to have the opportunity to share some of the achievements in the 23-24 report, particularly the positive results from 2 joint strategic inspections, one for adult support and protection and one for children at risk of harm. And the assurance that we can collectively take from these fantastic reports is testament to the commitment and resilience of our social work workforce and support of all the managers and leaders. So today, I'm asking you just to note, albeit the late noting of the content of this report, and I do intend to bring the most recent report to you as soon as possible in 2026. And I'm happy to take any questions if that would be helpful.
Thank you. Thank you very much, Lindsay. Can I just ask if there's any questions or comments for Lindsay? Elizabeth? And then Carol.
Thanks. Thanks, Lindsay, for that report. My question is quite general, so hopefully it won't matter that it was a while ago that you wrote the report. I just wanted to ask, in the report you allude to the difficulties nationally in social work recruitment, and I just wanted to find out, is that do we have tie-ins with local higher education establishments in terms of placements and so on, or do you find that helps in recruiting people into East Lothian? Thanks.
And that question's still relevant in the current report, so that's a good one. Yes, so we do have good links with local university establishments, but we have seen a reduction in student placements coming from universities. Since COVID, there's been a reduction of spaces available, and therefore the number of students we are offered has reduced. So we do have a range of practice educators within adult services and children's services, and we like to provide a variety of placements in East Lothian. And one of the good news stories is the vast majority of students do tend to want to stay once they've come and experienced the services that we deliver. That's really positive. So we're continuing to work with universities. We also attend career fairs anytime they're kind of looking to bring employing organisations into the university. We're making sure we're first on the list. So we are quite proactive in that space. I would say that there's been slow improvement in recruitment, and there are less vacancies. The SSC do a 6-monthly report on staffing, and we're seeing steady improvements in the level of staffing in East Lothian, and particularly against other smaller local authorities. We tend to do quite well. We've done quite well over the past financial year. So it's something I'm becoming a bit less concerned about, but I never want to become too complacent, because the job market is a fast moving place in social work, and people do choose to go for promotion, or they we have a lot of maternity leave in East Lothian just because of the nature of the people who we employ and who do social work jobs. And there's often gaps and vacancies across adults and children's. What I would say is adults are maybe more attractive for longer term positions than children's services. I think people burn out quite quickly in that kind of fast-paced, very high pressure. So adult services and justice don't tend to have the same level of recruitment issues as we see in children, but it's hopefully going to continue to be an improving picture, and we'll continue to maintain those links with university establishments.
Thanks, Lindsay.
Thank you. Carol?
That was exactly what I was going to ask, so she's answered it absolutely perfectly. Thank you, Lindsay.
Thank you. Thanks very much. Lindsay, John?
Yeah, hi. Yeah. Just again, probably quite a general question, I guess, or certainly more relevant to more recent years, rather than look back 2 years. I guess the question was around results of any feedback we've had from any external reviews and surveys of patients and their families in more recent times. It meant there's some quite good feedback in your report here in 23-24 in terms of Care Inspectorate doing inspection of children's services, and also a survey you did of patients and families at that time. So I guess you'll come to us with those in your later reports, but just sort of generally, what kind of feedback have you been getting in terms of those national reviews or surveys you've been doing, just to give us a kind of a bit of a external feel of how we're doing in East Lothian, rather than kind of marking our own homework. Thank you.
It's quite interesting because my role's quite challenging in a way, because I don't operationally manage any health and social care services, but I am professionally responsible for the practice of the service. So I do have that kind of slightly detached view, but that's really helpful because it allows me to ask lots of questions, and I do make sure that I keep myself informed about health and social care partnership business as much as I can, because I'm not in it every day, so it means it's an extra, I need to go the extra mile to find out about it. What I get fed back around about East Lothian's health and social care practice is that in many ways it's sector leading. I get asked an awful lot about how we are achieving some of the things we're achieving, particularly in the sphere of mental health and delayed discharge. East Lothian compares very favourably across the board nationally. That's not to say there aren't room for improvements. Of course there are, there always is. But the work that we've done to improve some of our outcomes and some of our data around particularly access to guardianship assessments, particularly with access to some justice services, has improved to the point that people are asking us how we've achieved that. So I certainly get a lot of confidence from that national comparison and feedback in that space. We've not had, so this next report will not report on a strategic inspection because we've not had one in that space. Children's Services probably do expect one within the next 2 years, maybe adults in the next 2 years as well, but we've not had one to report on. But what you do get in the Health and Social Care Partnership is very regular regulatory inspections, so the ones that go into care homes and care at home services, and that's been generally really positive. We've seen a real reduction in large-scale investigations across the home care population. For a while that was quite concerning. We always seem to have something on the go. At the moment that seems to be much better managed with the help of the dedicated kind of home care, what's it called? The dedicated care home teams that go in to support our local care homes, private and local authority run. So I feel quite confident that East Lothian is holding its own more than in the national sphere, and I'm always keen to hear particular feedback from inspection. But I work really closely so I have regular one-to-ones with the General Manager of Adult Social Work, with the Service Manager for Justice Social Work, and I'm introducing new one-to-ones with one of the new service managers in adult social work and also the learning disability service manager as well. And that allows me to keep in constant contact and gives me a window into practice. I also oversee all the guardianship applications. They all have to come through me for local authority guardianship. So I have quite a lot of opportunity to be, I call it a window into practice, because I'm not a practitioner anymore. I'm quite far removed from the front line, but I have to assure myself that what's happening there is of a high quality. So I have lots of opportunity and really good relationships in the Health and Social Care Partnership, which I don't think is always experienced in these kind of joint roles where someone's in the council, someone's in the partnership. I find the partnership to be extremely welcoming of the Chief Social Work Officer role, really keen to use me when they can, and I'm certainly not finding anything that I'd be raising concerns about. And those of you who know me will know I'm not be backwards and coming forwards if I do ever see anything that is concerning or something we need to tackle as an IJB. So generally my level of assurance is high for social work practice in East Lothian.
Thank you, John. Any other questions or comments for Lindsay? I don't see any. Lindsay, I just wanted to ask around, there's a really big section on page 24 around early intervention and prevention, and that the services are redesigned to intervene early and to prevent, to reduce and prevent crisis. And I know that a lot of that happens as you go through the report, there's demonstrate, and I just wondered how the best ways that we can demonstrate the positive work social work and social care are doing in the health and social care field, when sometimes we are kind of bogged into just delayed discharge, but actually social work and social care play a significant and important role in that, and how we just keep that kind of level of importance up there and demonstrate that actually this is a really important element of that.
Yeah, interestingly, that plays a big part in the next report. There's been a real shift on how teams are delivering their services in that space and working much more collaboratively to get in to avoid that crisis and avoid that critical intervention at a stage where things have maybe gone too far to prevent. And there's been a lot of reorganisation of certain teams, people working in different ways, and a lot of collaboration between hospital-based staff and community-based staff and social work staff together to really try and foresee problems and intervene earlier. So there's quite a large section of that in the 24-25 report. And it really is the focus of all of adult social work at the moment. You know, every time they're doing anything to improve their services, it's all about how can we make a difference at the right time to prevent escalation of concern. And that value really underpins everything that adult social work does at the moment.
That's great, thank you. And my final question was around equally safe. And I know there's a huge amount of really rightly so emphasis being placed around all our partners and just looking at how we as an IJB can be reassured as a health and social care partnership that we're taking that issue really seriously and embedding it in all our practices. And I don't know whether that might be something that might come through at the next report, or if you wanted to comment on that, or ways that you think we could be doing more in that area.
Yeah, and I'm happy to speak about Equally Safe. I try and keep Equally Safe out of a dedicated social work space, because I do believe that it's a much bigger agenda that touches all of our organisation in different ways. And that's why we really steered away in East Lothian from it being a social work chaired strategy group. It's chaired by one of our elected members. I think you're co-chair, Shameen. So it's got that kind of a far more kind of independent space within the council and IJB, but we really need to be bringing that work here to share that. We know that violence against women and girls continues to be a really significant contributor to some of the very acute problems experienced in our communities that do increase all our services, the demand for all our services at all levels, and particularly the reporting rates of domestic abuse and the use of our multi-agency risk assessment conferences, or MARAC, which consider the women or men who are at the highest risk of domestic homicide. The rates of those have increased, so significantly over the past 2 years that we have to really take cognizance of what that's telling us about local trends. So we can't get away from the fact that it is a huge problem in Scotland, but also in East Lothian. And Equally Safe, the strategy group, is looking to embed the new strategy into the new year. And at that point, I think it would be wise to then have an agenda item here where we can get a full update of the work and what we're planning to do over the next short to mid-term to try and really tackle some of the root causes and try and reduce the prevalence of the violence that women and girls are experiencing in our communities.
Thank you, Lindsay. I suppose that's as we're working our way through the strategic plan of making sure that it's embedded in there and it's reflected in our action plan for that as well. Okay, thank you. Thanks, Lindsay. John?
Yeah, sorry, just Lindsay just said it's not a question, it was a comment. Just saying those case studies at the end I thought were really interesting and really brought everything, brought it to life really in terms of what the team does and kind of the complexity of what they deal with and sort of the broad sort of skill sets they need to be able to deal with these situations. So I thought they were really good, actually, really sort of in different ways. I know it's sort of anecdotal to an extent, but I thought I really like them. So thanks for putting those sort of stories in.
Thank you. And it takes a lot to get staff to sort of sit down and reflect and give you that information.
I know, I'm sure. I mean, I think that's right. I think as long and they're sort of written just about in a way that we can understand them. I think sometimes that can be a bit too, the wording can be a bit too in-house sometimes, but I think it's just about okay. I understood them, so I guess it's not too. It was dumbed down enough for me, so fine.
That's good.
But they're really interesting. So yeah, I appreciate it. Actually, not easy to do. So really
they'll
good.
also feature in the next report. Unfortunately, unfortunately, we're going to do like a link to them rather than in the body of the report, because it's such a huge report and it's very difficult to make sure that everyone's read and been able to understand all of it. And it is very data heavy, and we appreciate that that's not always the easiest to read. So for me, it's really important to get across exactly that, the skill set, the complexity, what people are actually doing on a day-to-day basis, because I think it's quite easy to write social work off as something that's quite nice or an optional extra, but actually it's a critical part of delivering statutory legislation that we must adhere to in order to provide care, but also to provide protection, and that part of our role is often the trickiest. So I'm really pleased that they landed well, and we will follow that up with some more case studies in the next report, albeit with a link to get to them and not in the main body, so you can look out for them.
Okay.
Okay, thank you. Just want to ask if there's any other questions or comments for Lindsay. I don't see any other hands up. Lindsay, I'm just going to say a few words just to say that social work and social care, they're a critical frontline service, and I think that report outlines that, also conveys the complexity, the pressures and the risk that some social work and social care staff have to navigate themselves through, and this is the work that they're doing day in, day out, and they're working with people that face significant challenges that make day-to-day life increasingly difficult to manage, including the cost of living crisis, barriers to accessing mental health support, and more people than ever are facing poverty and disadvantage, and the demand for the service is increasing within East Lothian. And from the report from 23-24, there was 9,200 referrals. That was up 8% from the previous year. So it was just to say that they play, social work and social care play a vital role in addressing and championing the impact of poverty, inequality and the risks in the lives of vulnerable people across East Lothian. And from that perspective, these services are well placed to inform the prevention and early intervention agenda that are part of our plans that we talk about regularly. And so I think that's really important that we always remember that those frontline staff and social work, social care play a really important role in that prevention and early intervention agenda of crisis and having to access other services. So also just want to thank Lindsay for the support that she provides to Fiona Wilson and to David Hood as chief officers, but also to the other officers of the IJB for the support that you provide us, that reassurance. And you've also already mentioned the number of external validations and reports that provide highlight the good practice that's happening across East Lothian. So just from the IJB today, Lindsay, if you could pass on our thanks to all the social work and social care teams and thank them for the really valuable work that they are doing. And many of them will be working over the Christmas period and supporting vulnerable people across our communities. And we'll make sure that this is on the agenda for earlier for next year. Okay, thank you very much, Lindsay. Move on to agenda item number 7, which is the finance update and a 5-year plan from Mike.
Thank you, Chair. Afternoon, everyone. The report is an update on our financial position. And there isn't an update on the financial plan or the 5-year plan at this stage, but there is an update on our financial position. So the purpose of the report is to provide the IJB with an update on the year-to-date and forecast financial position, and also to provide an update on changes in the functions delegated to East Lothian IJB by East Lothian Council. So we'll start off with the financial update, and you'll recall from our last report at the last meeting that we were reporting a small year-to-date overspend and a forecast overspend of 651,000 for the IJB, and that all lay entirely within the health delegated functions. So the table 1 at the top of page 2 provides us with an update for the year-to-date position to the 31st of October, so the end of month 7. The figures are based on the actual information from the health delegated services and estimates within the council delegated services. So the year-to-date position and the forecast position have moved adversely quite significantly between month 6 and between quarter 2 and month 7. In terms of the drivers of that position, primarily it's within the prescribing budget, where the overspend has almost doubled between month 6. The monthly overspend is almost doubled between month 6 and month 7, and that relates primarily to a doubling in the price of a drug called tirzepatide, which is a diabetic or a drug used for diabetic care. I don't have any more information on that at this point in time, but we are looking to understand why that's happened, how it's happened, and what we can do to manage that position going forward. The position is also driven by a reduction in the vacancies across the health provided services and a small increase in the bank spend. So we are now forecasting an overspend of just over £1 million for the year end, and that's where we are at this point in time. Within the prescribing position, we do know that there will be some rebates at the end of the financial year, and those are built into the forecast at this point in time, but we don't know at this stage exactly how much they will be, and therefore there is still a little bit of uncertainty around that as we go forward. In terms of just moving on to the efficiencies, there is no change in the efficiencies information at this point from the Q2 position. So I've put the Q2 table in the paper just to remind everyone of where we were at that point in time, but there's no change in there's no update and no change in that position across council or health delegated services. The last bit of the paper talks about some changes that have taken place in the delegated functions from the council side of the IJB. So some services that were in our delegated functions have now been undelegated or are no longer delegated to us from a council perspective. These are services that were managed and have been managed by council officers. We have never had any management oversight of those services. If you remember going back to the budget setting papers that were presented, a key number of those services sat in other delegated services, or in a bracket or a grouping called other delegated services, and were related to HRA, housing revenue allocation funding. So those services have now been deemed undelegated and are no longer delegated to the IJB. There is no financial impact on the IJB's financial position. The budget of 1.4 million, 1.5 million will be removed, and they will sit now within the council's functions. There is one other service that's moved as well, and that's the telecare service. Again, this service has been managed by the head of communities and partnerships within the council, and that's where the expertise and the knowledge and the influence over the service that's been provided sits. So that service has also been undelegated, or is now no longer sitting with the IJB. Again, there is no financial impact in the IJB. There was an income budget, a net income budget that has moved back to the council. And that is a fairly quick update on where we are financially and the changes that have happened in terms of delegation, but happy to take any questions.
Thank you, Mike. Do you have any questions or comments for Mike? Mike, I've got two. One was around prescribing. So you've explained the rationale behind the prescribing budget doubling. I know that in previous years, our partners have received resources to focus on prescribing. Is there any indication if that will happen again? And what happens is when NHS Lothians receive some resource for prescribing, then it covers the IJBs as well. So I just wanted to ask that question around prescribing. And also, okay, I know some work's been done around people that are taking multiple levels of medications and doing work with them to look at reevaluating and making sure they're on the right, if that level of work will continue to support the prescribing budget. And the second one was around the telecare services. That'll be, you've mentioned, delegated to the head of communities and partnerships. It's just how are you reassured that the Health and Social Care Partnership will continue working with them, because there's huge strides being made in telecare services of as we're moving forward, of ways of supporting people safely in their homes. So it's just a reassurance that there'll be close partnership working with the individuals who will be managing the telecare services.
Okay, I'll try and take them in reverse order then. So in terms of the telecare, I'm probably not best placed to go into any detail, and I think Leslie is on the call today, but I see David's put his hand up. But my understanding is there is still a very close working relationship, because that's how the service works. But the responsibility for the telecare aspects of it sit with the council. But David might be able to say a bit more about that.
Okay, thank you. David?
I'll let David come in and then I'll come back.
Yeah, no, Mike has pretty much covered most of it. We still have a number of clinical staff who work within our Health and Social Care Partnership, occupational therapists, who have a very strong interest in telecare, and there is that direct link. This is about the kind of operational management in terms of responding to it, and it sits better with that team, but it is within the council team. But that clinical link and service link is absolutely paramount, and I think that was part of the consideration before having the conversation. So I think assured that this is really important, and actually those links will continue. And I think this will hopefully make it more easy to manage that interface.
Okay, thank you. I'll share the telecare information, the session that I went to, and I had a direct link to reduction in having to access emergency services and A&E services. So they'd carried out research to demonstrate that there was a reduction in individuals accessing those services with the use of telecare. Okay, thank you. And just one final thing, Mike, was if there are aware of any other resources that have been flagged up or that we're able to access, just to get a reassurance that we are applying for any resources that might be available to East Lothian IJB. I know we were allocated some unscheduled care resources that's helped our budget, but if there are any on the radar, I think it's really important to make sure that we're accessing them, because we've got a good case to make on the level of need and demand that we've got in East Lothian. So just to get a reassurance on that one.
Okay, yeah, I mean we are always we're always looking out for funding that we can access, and we make sure as a collective as well as individually that we are in touch with what's happening across healthcare in NHS and in council, to make sure that there's any funding that comes through the partner bodies that we are entitled to. Just going back to your earlier questions in terms of the sort of medication management and polypharmacy, that is an ongoing piece of work within the pharmacy services that support the primary care function. So yeah, that is a key part of them making sure that patients are not on medication that they don't need to be on, and making sure as well that the financial aspect of that is reflected in our spend. Just one little correction maybe for the minutes. When you started speaking there and asking those questions, you talked about a doubling of the budget. I maybe misquoted myself, but what I hope I said was it was the overspend that's doubled between 1.6 and 1.7 against prescribing. It's not the prescribing budget or anything that's doubled. It's the overspend that's doubled between 1.6 and 1.7. In terms of remuneration, in terms of budget and uplift, we did put a significant amount of, as did all the other IJBs in Lothian, a significant amount of funding that we received from the Health Board last year into the prescribing budget at the start of this financial year, recognising the challenges that are coming through in prescribing. And if that funding, if that type of funding comes through again from NHS Lothian, then we will have a discussion, and we will discuss within our partnerships and also across the 4 Lothian partnerships as to how we think the best way of using any flexible resources. But obviously prescribing is our biggest level of overspend that we have, so it will be there in terms of a key aspect that we might want to put money into next financial year. But it depends on whether or not that funding comes through the Scottish Government and is subsequently passed on to the IJBs.
Okay, thank you. I'll just check if there's any other questions or comments for Mike. I don't see any. So Mike, thank you for the report. We will keep a close eye on our finances and just be looking out for other resources that will be coming our way. I think just from looking at the Chief Social Work Officer's report, the level of referrals and demand that we're seeing, got a clear case to be able to put forward that, you know, East Lothian is a growing area, and that our level of demand for need is, you know, our residents require that level of support. So we've got a clear demonstrated need for that. Okay, so this paper is just for noting, Mike, and then at the next IJB there'll be another finance update.
Yes, yeah, the February IJB will bring an update, and then obviously in the March IJB the intention will be to bring the funding offers and the budget, the balanced budget proposals.
Okay, thank you, Mike. Are we content to note Mike's report? Okay, thank you. Move on to agenda item number 8, which is a review of the IJB reserves policy, and that's with yourself, Mike.
Okay, thank you again, Chair. So there's this covering paper sort of outlines the review that's taken place on the IJB reserves policy, and it highlights the key aspects that are within the policy within the covering paper. The review itself is triggered by the full release of the IJB's general reserves in the last financial year, 24-25. However, when I went back to dig out the reserves policy, I noted that the last time it had been reviewed, or the last time it had been reviewed was when it was adopted in 2016. So it was well overdue to be reviewed anyway. So it's a timely opportunity to review the policy itself. The covering paper itself highlights the importance that reserves policy plays in public sector financial planning, and also explains the main reasons for holding reserves. It also sets out the difference between general reserves and earmarked reserves, which are the two categories of reserves. And as you'll recall from the annual accounts, we still hold earmarked reserves of 1.466 million in our position. So we still have a number and value of earmarked reserves. The policy review itself identified that a prudent level of general reserves for East Lothian IJB would be 2%. Now that is in keeping with the other IJBs in Lothian, so the other IJBs have a similar level of general reserves policy, and it's a level that can be worked towards. But it's also worth noting that generating the reserves needs to be considered in the context of the level of savings that are required each year to deliver a balanced budget, and also the financial landscape. And we know from our medium-term financial plan that we have a challenges ahead in terms of closing the projected financial gap year on year. So the covering paper proposes that we take a pragmatic, stepped approach, and we try to rebuild our general reserves over a number of years. Overall, the review concluded that the presented policy provides a robust framework in terms of defining the purpose, use, and governance of our reserves rather. And the paper recommends that the IJB approve and adopt the draft reserves policy in the appendix to the paper. I'm happy to take any questions.
Thank you, Mike. Can I just open up for questions or comments for Mike? John?
Yeah, thanks. I mean, I'm sure 2% is probably the sensible benchmark. I guess my question is simply, what do you really sort of mean in terms of that recommendation, pragmatic approach and medium term for this year and next year? Because you're not proposing, I don't think you're proposing that we do try to set aside some reserves for this year, I guess. And is it even practical to consider, even realistic? I mean, it's okay to have as a policy, but you know, I'm struggling to really understand what we're really going to do here, given what you've described and very sensibly described.
Yeah, and you're right in what you say, Jonathan. The challenges are great in terms of us being able to actually build up that general reserve again. So we need to weigh up our situation in each of the financial years that we approach, and also what our gap is, how easily we can close that gap in terms of identifying efficiencies. And if there becomes a year where our financial we have good settlements, that our partners get good settlements and pass on good settlements and good allocations to the IJB, our gap isn't huge, we can identify sufficient efficiencies and more to close that gap, then we would be in a potential position to identify some reserves. But there are a lot of things that need to, as you say, happen for that to take place. But it's important that we do still have that reserves policy there to support that situation, and also for the function of the earmarked reserves that we will continue to hold and use year in, year out as we go forward. But the financial landscape is challenging, and it will be difficult to build up a substantial or reasonable level of reserves over the coming few years. But that doesn't mean we shouldn't have a policy, and we shouldn't be endeavouring to do that where it is possible. Is that okay? That answers your question.
Yeah, that's the yes, that's a very sensible response.
Yeah. Mike, I just wanted to ask around, there's a section on here, because we will have earmarked reserves because maybe some resources have come in and they are not being able to, being able to spend within the year, because sometimes you do get things later on in the year rather than having a full year to be able to spend to get it out the door. And so it's implying that it's suggested not to have those. And I suppose I'm just thinking from a manager's perspective that if you do have a resource and it's earmarked specifically and you haven't been able to spend it within the time scale that you would have liked to, that there is some protection for you to be able to still be able to use that.
Yeah, that's exactly what the earmarked reserves are, Shameen. They are allocations of funding or funding streams that we get, but they have a specific criteria for what they can be spent against, as opposed to a general budget that we would receive. So the carers money is an example of that. The unscheduled care money was an example of that. We've had sexual health money in the past. We've had learning disability assessment money in the past. So these are specific funding streams. Some of them we get regularly and some of them we don't, where we can only release them against certain aspects of our business. So that's why sometimes we have to carry them forward, because we will maybe receive more in each year, and we haven't had the level of criteria met for us to release them all in year. So we will still have that that process and that ability to do that. The question that Jonathan, I think, was talking about was around the general reserves and whether or not we will be able to build up general reserves. But earmarked reserves we will still have a purpose for, and we'll still manage year on year, and will still be part of our reserves policy.
Okay, I'll maybe just pick that up with you on section there, 3.2, maybe just how I've read that. And the other areas, it's always been my understanding if, IJBs are a separate entity body, and that if an IJB does have a reserve, it's the IJB's reserve, it's not the partner's reserve. So just to get clarity on that's always been my understanding. And it's the IJB itself that then directs what it should or shouldn't do with those reserves.
That's right. Yeah, no, that's absolutely right. The reserves are the IJB's reserves, and it's up to the IJB how they utilise those reserves, and that's what happened last year. There was a decision made to release those reserves, as in prior years to that. There was decisions to release those reserves in direct response to certain pressures that we had. So yes, the answer is yes to your question. It's absolutely the IJB's prerogative as to what they do with those reserves.
Okay, thank you. John?
Yeah, just building on this point about how do we, in a pragmatic way, build up the reserves again to give us this flexibility, financial flexibility we want. And I guess, what are the options for us, Mike? Is there anything you can propose to us as an IJB in terms of options that we do have this year, but there's only 3 months left or into next year, but we should be considering as an IJB? They may not be palatable options potentially, but if our policy or strategy is to build the reserves up rather than sort of waiting for the good years to come and be able to have the ability to just do it and build them up, I don't know, what is it? Should we be asking you to come up with some options for us to at least start to build that up? Maybe it's in a small way to start with, either this year or for next year. I guess that's, that'd be my question, really.
Yeah, I think you're right in terms of this year. We are unlikely to be in a position to generate reserves in this financial year, given that we're forecasting a significant overspend. But I suppose going forward, key to us having a strong financial base, and that's where we start from, is us having fair and good settlements from our partners, where we get full funding for all the things that we should get, like pay and all the pass-throughs, and we get some funding towards some of our pressures, and that allows us to do our business and to explore further opportunities, I suppose, in terms of how we can generate transformational change. It's not far easier, but it is a bit easier to do that if you've got a stable base. And up until this year, we have had a much more stable base, and it's been easier for us to start to plan ahead. So the other thing I would say is that we continue to do what we're doing in terms of planning ahead and trying to generate some change on a larger scale that will allow us to make those changes and to cover any financial gap that we have from year to year, but also to generate some reserves or some funding that we could put into reserves and allow us to have a flexible resource that we can then make further changes. And that's really what you want. If you've got a reserve, you really want to be able to use it as a flexible way of sort of projecting further change and financing further change. And that's where the difficulties come, is that trying to make change without a little bit of sort of one-off funding to pump prime it is difficult. But sorry, I haven't got a magic wand in that respect, but I think when we meet and we discuss the efficiencies that we have to identify, then we can also discuss how we consider reserves at that point in time as well.
Okay, yes, that's sensible. Thank you.
Okay, thank you, John. Thank you, Mike. I just want to check if there's any other questions or comments for Mike. I don't see any other ones. And Mike, thank you for pulling together. I'm assuming that you've worked with both partners to engage with both partners in putting this forward. And having the reserves is really important for an IJB. As we no longer have reserves, we are now higher up in the risk register as a result of that. And I know that we'll be making sure that we apply for any additional resources, whether it be unscheduled care or any of the resources that Scottish Government might be putting forward. We did ask at the last NHS meeting that we know the government has got a £1 billion underspend, whether we knew if anything would be coming through that. And what we've been told through COSLA is that the underspend is as a result of a number of projects not progressing. So we'll still keep asking the question around additional resource for social work and social care and health. But for today, what we're looking for is to note the report and approve the draft reserves policy. I think, Mike, if at any time you feel that it has to be changed and you have to come back, then please come back to us. But it's there to make sure that we implement that. So when we are making decisions, we have to be cognizant of our reserves policy of trying to strive towards that 2%. Okay, is there a general agreement in accepting the reserves policy? Okay, that's grand. Just take a note of that. That's been agreed. So thank you very much. That's the end of our integration joint board meeting. I just want to thank you everybody for your participation today. And I just want to ask all the officers, Lindsay, yourself, and social workers, social care staff that will be working over the holiday period, supporting some of our most vulnerable children and families and older people across the county. Crookston Care Home will be open, so there'll be numbers of people across the social work and social care sector that will be supporting everybody over the festive season. So if officers could pass on our thanks to them for their hard work and support, and it's really much appreciated, because I know with the cost of living crisis and the run up to Christmas, and can be a really difficult, challenging time for families and individuals in our local communities. And we're really appreciative of the support that our staff, frontline staff, provide to our communities and support the work of the Health and Social Care Partnership. And Marilyn, I wish you all the very best in whatever you decide to move on to, and thank you very much for all your contributions. So, and I wish everybody a very Merry Christmas and a very Happy New Year, and you have 39 minutes of your time back. So thank you very much.
Right.
Thanks, Amir. Thank you, everyone.
Thank you.
Thank you.
Paul, can you switch off the recording? Oh, you're on mute.
I'm just trying to find the off button. Here we go. And stop.
Thank you. Are you able to, I'm not sure who it is that you